70 participants and counting. So that's actually more than I think we've ever had in anything we've ever done. But we also recognize that this is a very critical and pivotal point as we start moving back towards some sense of normalcy. For those who have been on our Friday morning calls in the past, welcome back. We appreciate your insight and your suggestions as a resident. I think I know for sure we have a quorum, and I believe we have all of the board members, if not on, coming on very soon.
I can't find my.
We all set? Okay. So we're going to open this up as a guide. So we have the agenda. I think for those of you who are actually on the web, you can see that we have our agenda. We will follow that. As far as our open conversation, the rule that we've been following is we have the management do the presentation. Board members will then respond.
I can't find my
open, and then we can
speaker.
open it up to everybody. And I'm going to ask Patrick. I think we need somebody muted. That I don't think they realize that they're on. So we will go ahead and open it up for public comment. After the board members speak. We are going to be asking, because obviously this is a hot topic, that you try to keep your point concise. If it's already been covered, you can say, yes, I agree with what's been discussed. If you disagree, then you can say what it is you disagree with. But I am not sure of how many people will actually want to be talking and discussing. So we'll try and keep this as quick and concise as possible. So with that, I believe all board members, we have one that will be joining us. She's just wrapping up, Marianne will be wrapping up a call with her regular job, so she'll be cutting over soon. All the board members should be able to mute and unmute themselves. Residents, if you are on the web, you can raise your hand and ask your questions that way. So with that, I'm going to motion to adopt the agenda. We'll call the meeting to order first, and then I'm going to motion to adopt the agenda. Board members, do I have a motion?
Motion to adopt.
Thank you, Debbie. Do I have a second?
Second.
Was that Diana?
Yes, it is.
Thank you, Diana. All in favor?
Well, first of all, do comments. Under the question was raised under B, if that includes dog park. I think it should include dog park. I just want to clarify that.
Thank you, Brian.
Yep, I'm good with that. Any other comments? Diana, are you good with adding that on there since it was your second? Thank you. Okay, all in favor?
Aye.
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 Any opposed? Perfect. Steve, I'm going to go ahead and open it up to you to discuss the governor's plan. Actually, before that, I want to just kind of give one quick statement. There was some concerns about not posting the plan until 5 o'clock last evening. Our reason for doing that is we had to ensure that we were in compliance with the state, which did not release theirs until Wednesday evening. And then we had to wait for the county to announce what their plans were, which wasn't until yesterday afternoon. So that's why there was a delay. So thank you very much. Go ahead, Steve.
Yeah, thank you, Vanessa, and good morning, everybody. As you can see, Patrick's going to switch the screen over here. You'll see the recommendations for reopening the community that the management team has put together. And to do this, we looked at, as Vanessa stated, we wanted to, the stay-at-home order was ending from the governor, and we were waiting to see what the new executive order would look like so we could build our plan around that. We had a White House opening of America phase plan, and then we had the governor's reopening plan, and where there were holes within that reopening from the governor's recommendations in phase one, we then went and looked at CDC for guidelines, looked at National Rec and Parks Association for guidelines. I reached out to the local Florida hospital or local Celebration Hospital. I've been waiting to see if they have any additional guidelines. I have not received anything yet, but we reached out to multiple different groups to put together the plan that you're going to see in front of you here this morning. And again, this is a draft recommendation. After we're done with this discussion, we'll ask the board to vote for approval for reopening of facilities. But I'm just going to kind of quickly go through this plan this morning through phase one, And then if any board members want to add to that, and then discussion on the opening of the facilities. But first and foremost, we want to ensure the safety of employees and the residents that are utilizing these facilities. So we talk a little bit about the guidelines and responsibilities. And the first, as we get back out there, physical distancing, social distancing is still going to be kind of the norm as we're in phase 1. And that's encouraging folks to stand 6 feet apart from each other. Now, CROA staff, CCMC staff, park monitors, and folks that will be out and about in the community will continue to advise residents of 6 feet social distancing, but we have no enforcement authority over that. So we're going to ask residents to enforce that yourselves and continue to stay 6 feet apart, and try and not gather more than 10 in any type of social gatherings, which is the recommendation from the governor's executive outline. We also have hand washing and sanitizing. We'll have multiple signs up to continue to encourage correct hygiene, frequent hand washing. And then we have a ton of signage that we'll be putting up throughout the community. Temporary signage as we're in phase 1, signage will start reducing as we move into phase 2, and then hopefully phase 3 of getting closer back to normal of what we were before we went into this pandemic. So then we also have employee and community member health concerns, and we will just continue to encourage folks, including my staff, that if you're not feeling well, if you have any of the symptoms that have been outlined through the CDC, to please stay home and do not go out, and continue to self-isolate if you have any of these symptoms. For case notifications, if we see of any, or if we hear of any COVID-19 related cases that utilize community facilities, we'll work with the Florida Health Department to make sure that we take whatever appropriate actions are needed to shut those down and clean them and get them ready to reopen. And then our employees will look at some of the safety and sanitation protocols that we provided for them. We have a ton of information on our CCMC SharePoint site that we can utilize for understanding how we're going to reopen. So we'll go through that, and then we're going to provide the personal protective equipment. We'll have masks for those that are in close interaction with residents or guests, and we'll also have gloves and any other protective equipment that's needed for getting the facilities reopened. So those are just kind of the general guidelines. And then we kind of move into what the phases look like of what can we recommend to be reopened in phase 1. And I did, in my initial draft, put some staffing plans in there. I have a follow-up meeting after we're done with this meeting with my department heads. We're going to try and get everybody back on site next week, and starting on Monday, and make sure we have the resources spread out throughout the community that are needed, so that we can ensure that the facilities are being open properly. I do want to state again, though, as we start talking about these recommendations for reopening the facilities, CCMC staff will not be an enforcement arm or enforcement authority. And I don't believe that there is any type of police enforcement on these. So we're going to really ask residents to work together to ensure that this enforcement's taking place. So as we open the facilities, we want to get our signs out. We have quite a bit of signage that JR, our communication director, has put together, utilizing CDC guidelines and USTA best practices for tennis courts and those types of things. So the recommendations for reopening in phase 1 of the parks are pools, the open space parks, tennis courts, the open fields, and the dog park. Those would all reopen. And to do that, 25% of the pool furniture will be set up during phase 1, and the tennis courts will reopen. And we have some guidelines here from USDA, and these will be turned into a sign. So those will be posted around the tennis court facilities. And then we also talk about park monitors, highly encouraging residents to follow social distancing protocols, as I spoke about, cleaning the facilities, the office, the door handles, restroom, tables, any of the equipment that we have out on site.
Steve, we lost you.
I still
You guys
have
can't
him.
hear?
Steve?
I can hear him.
I'm here.
Yeah, I can
Can
still.
Vanessa, part of the problem might be we have a limit of 100, and we have 100 participants with more trying to get in. So I don't know if that's creating an issue, but I can hear Steve. but Vanessa needs to hear you also. Let's give it a second for Patrick to
Yep.
check.
Vanessa, are you still there?
And Steve, I guess we need to let Patrick know to
Still
bump
logged
up.
in.
Vanessa is still connected. I see her. I'm checking on the participant level.
We're over 100. Well, we're at 100, which is our max. We need to bump to 2 for the next meeting, which is great.
That is great. We figured this would be a hot topic that people would want to tune in for. Patrick, is it possible to just bump it now? Is that what you're looking into?
I'm looking into that right now.
And while we wait to get our president back on, is David still there?
I'm here.
Okay, so we still have the vice president.
I'm back on.
Okay, Vanessa's
That's
back.
true. That's true. What happened. Sorry about that. All of
Okay.
a sudden, I'm like, oh,
So-
I'm gone.
So
Okay.
Vanessa, Patrick's looking to, we're at 100, we're at a limit
Yeah.
for what we purchased. So Patrick's looking to see if he can purchase an additional to bump it to 200.
Thank you very much. We're going to, try and do that as quickly as we can. Thank you.
So Vanessa, I think that when it comes to service area and community standards, business office, those are all kind of smaller items compared to the opening of the parks. Do you want to have the discussion of those parks facilities first, move into the lifestyle events, and then I can wrap up at the end with the other smaller items?
I'm good with that. Board, does that sound fair?
This
Thumbs up?
is Kevin.
Yep.
This is Kevin. Hello, everybody. I apologize. I just don't know if it would be most appropriate to find a solution, because if there are other residents that want to be part of this meeting, I don't know what conflict that might cause in the future if we are not allowing everybody in.
I think right now we're okay, and I say that only because we're still under our executive order. So legally, I believe we're protected. Now, whether or not we want to go into it's the right thing, wrong thing to do, that's another discussion. But legally, we are able to do this. I think the one thing we need to be careful of is we do have this recorded, so everybody can go back onto it, and we still have emails. But I'll leave it up to the board as to how to move forward. I just want to make sure that we have those two things are available. That's while we're in transition. Go ahead, anybody?
This is David. We have limited amount of time, so we're not going to have everyone talking anyway. We have, 50 minutes left, and we have a posted meeting 48 hours ahead, so I'd hate to postpone. And so back to the initial question, I would suggest that and I shared this with the board, we as a board received this about 24 hours ago. So I would suggest to the board something that I did share, some guiding principles, because to work through all the details, and I know I personally sent about a dozen suggestions that are not part of what's been publicized. So I think we should talk about what our guiding principles are moving forward before we get into the specifics of pool, town hall, amenities, events, and so forth. Without guiding principles, we'll be floundering, in my opinion.
And this is Brian Kinsel. Maybe I would recommend, I'm fine with what David suggested, and maybe we just need to have another call then on like Tuesday when we can expand this. We've got a lot of interest. I'm more interested in us taking the time to do it properly than hurrying.
I agree.
That is my point. I'm not in a rush. I don't want to do something that we change 3 days later. I want to think this through and have this in a thoughtful way. And I love the community engagement. I think that's very important. But we just have to frame it.
Board, anybody else? I got two.
Vanessa, I'm sorry, I didn't hear. Do we have a quick stop at 11, or can we extend? I'm able to
I
extend.
think it's hard because I think our posting is from 10 to 11. Is that correct, Steve?
That's the way it's posted, correct?
Yeah.
I assume you've got Zoom for an hour and a half though, right, Steve?
Patrick, how long did you schedule it for?
It's scheduled for an hour, but we can extend if you need to.
I don't have a problem extending it if that's okay with the board.
That's fine. I don't know how much. I don't know how much engagement we'll have, so I guess we'll find out.
Would you like for David to go through those guiding principles first then?
Board?
I think that would be a good idea.
And those were shared, you know, just for public record, those were shared with board and management, and those could be posted because those were sent in an email yesterday afternoon. I mean, I can read them. There's 9 of them. It just it helps to frame us.
Put it up on the screen? Or
Yeah,
does
they can be put up on the screen.
I don't know if Patrick has it. You should be able to share though. You should be able to share your screen, David.
I can share my screen, huh?
Or David, you can just read them. It wasn't too long, if that's okay.
I'll just read them.
And a lot of those are addressed within the narrative that I've gone over too. But yeah, I think I can see if I can find it and get it to Patrick.
You can find it. Well, let me just read through it. The first one is talking all of our, and we've talked about this as a board in the past. You know, we do have state standards that will change again because we've only heard about phase 1. But the first guideline is all standards and guidelines. That's for us, for CROA. All standards and guidelines will strive to be in compliance with state and county laws, ordinances, and executive orders. Where there is ambiguity or no direction, additional guidance on best practices at the national, state, and local levels will be adopted. For example, Centers for Disease Control and Prevention. And Steve, you've already addressed that. The second is, and you've addressed this, the health and safety of residents coupled with the protection of CROA assets are the top priority. Third, the health and safety of employees and contractors is equally a top priority. Employees will be provided necessary personal protective equipment and procedures. Contractors' leadership will be notified of CROA's standards and policies and asked to follow these. Contractors like Evergreen. Not Evergreen, yeah.
Yellowstone.
Yellowstone. And Evergreen also with Arlington. Item 4, communication with residents will be ongoing and timely. And here you have this here. Ongoing and timely, and use multiple channels. This will cite the content and rationale for CROA policies and procedures. 5th, communication about CROA decisions and standards will be shared actively with other local entities. So that's those entities that are not within our purview, but we collaborate and cooperate, and we'll encourage them to do what we've decided to do. Standards for opening and related resources at each CROA property will vary based on the nature of the property. So pools may be different from tennis courts, which is different from town hall, which is different from basketball, or not. They may be. Preparation, this is item 7, preparation to respond quickly exists and will be implemented as deemed necessary. This may be needed to close selected facilities based on changing circumstances. In other words, if you're following the modeling, if people get a little sloppy and careless, then we will see a resurgence. Residents are encouraged to become engaged with CROA properties and amenities based on their personal levels of comfort. The use of technological options will be actively explored for implementation, such as having the capability for meetings to blend on-site and remote engagement. So you may have a committee meeting with 3 people on site and 4 who are remote. And last, all decisions and deliberations are based on CROA providing leadership for the HOA, emphasizing personal responsibility of residents and encouraging other local entities to support CROA standards. Those were just meant to help anchor our discussion and a lot of the specifics as we move forward. And that was just a personal draft just to help guide us. We did the same with the Parks and Recreation Master Plan.
And the guidelines and the recommendations that I have laid out here in draft form, we do talk about reducing the amount of pool furniture out of the pools. We do talk about separating the chairs at the dog park so that they're not within 6 feet of each other. So we are reducing the number of places where people can sit and congregate in these facilities. But again, it's going to be very hard and difficult to police that. I think what David's kind of outlined there is that if it gets out of control and we start seeing issues with it again, then the CROA board has the authority to reclose those facilities.
And I think, Steve, what you just said is with that signage and with our multiple communication, it's really up to individuals to make their personal choice for themselves and their families.
Right. And I'd probably bet that most of the folks that are on today want to know whether the CROA board is going to be reopening facilities or not starting on Monday. So the facilities that I just went over were pools, tennis courts, the open fields, and the dog park.
Steve, real quick question on pools. I could not find any direct information on pools being included. Do we have a CPO on staff since Todd left?
A certified pool operator?
Correct.
Mike, do you have a certified pool operation license, Mike?
He may not be able to unmute himself.
He might not be on. I'll check on that, Debbie. I'll check on that. But I believe our vendor that we utilize to clean the pools has a certified pool operator license. But CDC does have some guidelines for pools, and they are on the due for opening.
Okay. Did you send those to us? Because I didn't see it under the governors or under the counties.
I believe there was a follow-up email where I sent a CDC guideline listing. It was a 3-page listing of CDC guidelines, but anyone can access it from the CDC website.
Okay. Was that for phase 1?
Yes, and those were what we were going to. That was what we were going to utilize to turn into the signs,
Okay,
do's and don'ts for parks. And one of the don'ts on there was playgrounds. They did have a don't open playgrounds yet.
Correct.
So basically, Steve, the state said you could open pools, it said you could open parks, it said you should not open playgrounds. The dog park was acceptable to open, correct?
Correct.
State was kind of silent on those, so we went to CDC and looked at what their guidelines were, and yes, that's where my recommendations are based on. So the state is not stopping you from opening these at this point in time. And neither is the county. The county is going to go along with what the state guidelines are. Kevin asked, I believe, what other CCMC community is doing. Each CCMC community has a board of directors through their homeowner association, so they're all voting individually. And each state is opening differently also. So we did share plans amongst each other within the state of Florida, and I did use that as a guideline for the draft that I have in front of you today.
How do you want to attack this, Vanessa?
Go ahead. I'm sorry. What was that, Brian? I missed what you said.
How do you want to attack what we open, don't open? I mean, just so do we want to discuss?
I wanted to make sure that everybody had an opportunity on the board right now just to kind of discuss. I know one thing was questioned as to whether or not do we want to actually adopt these principles going forward. That David had suggested, or do we just want to go full steam ahead? So I'll leave that to the board. And then I would like to, before we actually do that, I know Jerry is a physician and a health expert and deals with immunology and a wide variety of things. So I would like, since he's on there, I would like to open it up just for his comments. Just as a quick reminder to residents, we're going to have board feedback, and then we'll go ahead and open it up to residents. So I don't want you to forget that I'm ignoring you. I do see hands there, so thank you. So thoughts from the board?
I'm going back to page 1, if we could. Excuse me, under the information on the screen. Can we bring it back to page 1? Sorry, Patrick's probably trying to add more people on. There it is. Thank you, Patrick. Yes, under employee and community member health concerns, I expressed this in a meeting yesterday, and I have spoken to leadership at the hospital, and it is my strong opinion this is a HIPAA violation, and I would like this paragraph to be removed. If it stays, I would need a request that the attorney approve this, because none of the staff is certified in health. Even the directors of the hospital, as they test all 2,000 employees, are not made aware if there's a positive case. Only the HR is aware of a positive case, and they're given, of course, 2 weeks to quarantine.
And I just want to point out that this is not asking for positive cases. This is saying that if we notice a coworker or any member cough, shortness of breath, any of those symptoms, that they notify a manager so that we can try and get those facilities cleaned, so that we can try and avoid the spread of this virus. It's not about identifying anybody that has the virus.
Okay, perhaps some rewording then, because it almost looks like they're supposed to report immediately back to you and they're being trained to do so.
This is Kevin, guys. I'm going to echo Debbie's concern regarding that specific paragraph. Something just isn't sitting right with me on that. To go ahead, if somebody has a cough or a sneeze or appears to be warm when they're outside or any of these types of things, I want to have a lot of caution. If that is part of our opening plan, are we ready to open? I don't know. But I'm just uncomfortable with that paragraph.
Steve, I don't know. I'll put this out to the whole. I'm going to put this out to the whole board for a quick second. I'm fine with removing that. I actually think it's more of a CCMC policy, more so than a board policy. So how they want to handle that, I think, is okay. But I'll put that open to the whole board. But I'm fine removing it if that's what.
I don't have a problem. I don't think the CCMC would require us to have it in there either. It was in some other plans that I have seen. But again, I think it was in our initial preparedness plan also that if we see any symptoms and we see any type of fever or those types of things, that we try and clean those facilities so that we can avoid the spread of the virus. But I can remove that wording. That's not going to be mission critical to this opening plan.
Board?
Okay, Vanessa, so we can start the conversation. I'll just be happy to go first then. If it was.
Okay. Do you want, now first, before you do that, do you want me to ask Jerry to speak really quick from a medical perspective?
Sure.
That's
Okay. Jerry, I'm going to unmute you here. Hold on a second. I need to track you down. Just a second. If anybody else can help me with
I've
this.
unmuted him.
Thank
I'm
you.
unmuted.
Okay,
So
you're all set, Jerry. I just need you to speak up.
My name is Gerald Barr. I live at 1138 Mosaic Drive. I am a former ICU director. I'm a board certified intensive care specialist. I am a practicing physician at Celebration Hospital. I also served on an Ebola team from 2014 to 2017 in New York, at which time I moved full-time to this area. I think all these things that you're doing are very well intentioned, but you're doing it in such a way that you're sort of losing sight of the fact. I've treated over 1,000 patients on ventilators. I've seen some of them die. I've seen a lot of them get better. You as a group have never seen any of this, and I think you should have the most conservative type of rules to whatever you're going to do. For example, for CCMC employees, I think they should wear they should wear masks all the time. We should encourage all the residents to wear masks, hand washing, and just being very forthright in encouraging our community to use social distancing. Also, I would have other comments at a time when you're going to talk about some of these big events, but you're not talking about those today. And remember also, we have a large population of at-risk people who are older or other people with comorbidities, and we have to be cognizant of them as well. Thank you.
Thank you, Jerry.
Thank you, Jerry.
Okay. Okay, Brian, it's all you. Can you unmute yourself? You're muted. There you go.
Somebody just did the. Okay, I'm unmuted now.
There you go.
I'm just going to throw out my ideas because obviously everybody's hesitating to go first, so I'll be the ceremonial pig that gets slaughtered. If it was me, I would open the parks. And I'm working under the theory that I think we've got a lot of people who've been locked up for a month. I think we have a lot of people who are ready to bust at the seams. So I'm trying to find common sense. There's a lot in here where we really need to communicate that people are going to need to use common sense, distancing, masks and stuff like that. But I think if we open the parks, if we open the dog park, which I would do, and I would open the pools, I would do it very carefully. I think we need to talk about the rules around that. And I don't think we're getting through all those today. So I don't think we need to open everything on Monday. I think we need to say, this is what we want to do. And then how do we do it this next Friday or whatever day it is we actually open them? Great. Playgrounds, I wouldn't do. We're down to a couple of events like the 4th of July where we've got a deadline. I would not do the 4th of July. I think control is impossible regardless of how well-intentioned people are. Memorial Day with the flag ceremony, I think it would be great to try to do that. I think we could use distancing. And then if you got something like the kids clubs and some of that, I'd really like to challenge Nikki and some of them to find a way to do that in a safe environment. Because if we're going to take away certain things, creating something else where people can then burn off energy and stuff like that. And, you know, yes, we won't have people working on X, but we can have them work on Y. And if we can do small kids play type things or something like that, I think there's value in pursuing that. So I'm just willing to go first and bounce ideas for feedback.
And Brian, I do want to, before we end today, I definitely want to have the conversation about 4th of July, Memorial Day, and summer camp. And if it's okay with the board, we would like to see some direction on what we're doing with the pools, the tennis courts, the fields, and the dog park.
I'm with you on that. I think we should be able to do that today. I have but I think one critical aspect of this is, I don't know about any other residents here, but getting any type of disinfectant or paper towels or supplies in general is hard. Does CCMC have the ability to get those supplies to keep us in stock with hand sanitizers, disinfectants, etc.? I think that's just a practical question. Can we actually do it?
Yeah, we're getting the facilities that will be reopened, if the board approves, we're getting them cleaned today. And then, Mike, are you on? Susan, have you had conversations with Mike about the availability of getting the disinfectants and the hand wipes, or the wipes and stuff? I know that we have hand sanitizers. We have 6 different hand sanitizer stations. Okay, there's
Mike's on now.
Go ahead, Mike.
Hi, we have a supply company that can get us the supplies that we need. There are times, the one concern I had, which I'm glad we're not doing in stage 1, is the gym with wipes. Those are still being pushed to the medical demand, so they are hard to get. We do have a supply of them. Regarding the hand sanitizers as well, we can get those supplies for the foaming hand sanitizers, so we can get the stuff. There might be a time down the road if there are other peaks in other areas where they start redirecting those supplies, where we might have to make a change and possibly readdress certain things that we have open just because we don't have the supply. But right now, we look good on that front.
And,
okay,
you mentioned the wipes for the gym, but we're not even recommending the gym be open in phase 1. That's future phase.
Right. But
it
what
is
we are talking about.
Go ahead. I was going to say, but it's not unrealistic to expect that all of a sudden the governor's going to lift something, or the county will lift things, and those that'll be available. And it could be as soon as a week, it could be 2 weeks. So I don't know that we're looking in the months off. So just to be clear on that.
This is Mike again, sorry. With the supply company that we're using, Gem Supply, they have a list of all the products that we do use, additional sanitizing products that we will start using, and they do have that supply for us. They have a good amount, but they did warn us if there was any kind of outbreak somewhere throughout the country, those supplies are taken from them and shipped off. Just keep that in the back of your mind with this, but as of now, we have all the product that we do need.
Thank you. Now that we have that information, any other board members? Thank you, Brian. Any other board members?
Yes, I would like to speak.
Go ahead, Diana. We're having a hard, can you speak up a little bit more for me?
Yeah, sorry, I'm on my computer audio, so is that better?
Yes.
Okay. I agree with what Brian said. I think we can go ahead and open the pools, but I don't think we have clear guidelines on what opening the pools look like. Removing 25% of, or only putting out 25% of the chairs is not going to limit the number of people that go to the pool. They don't have chairs, not necessary. So I think we need to have some guidelines on numbers of people that can enter or how that looks. And I would look for CCMC to give us some suggestions on how to monitor that, because there's a lot of pent-up demand for the swimming pools, and I understand that. I also would suggest that maybe we implement, if we are going to open the pools, that we implement either a senior day or a, I don't know that seniors are even interested in using the pool because they're in a high-risk group, but that we offer that as an option. I agree, the playgrounds we shouldn't open, the gyms we shouldn't open, the free park space we should open, the dog park we should definitely open. Summer camp, I'm pretty in touch with with summer camps, summer dance camps, Girl Scout camps, and all of those have been completely closed for the entire summer. And I think having our day camp does present some hazards. I love the agenda. I think the camp looks great that Nikki and CCMC have planned, but being able to live up to that commitment and do a lot of those activities, I think may be out of the realm of possibilities. I would vote against the plan right now to open summer breakout, but if there's a better, if I'm open to considering a new plan that maybe offers some safety concerns. I mean, again, if we're limiting the number of people at the pool, the summer breakout kids spend a lot of time at the pool. If the playground is closed, they spend a lot of time at the playground. So I think all of that added up, I think that implements a close. I think Memorial Day can be done with social distancing. I'm fine with that. 4th of July, I think we need to just say, we're going to cancel 4th of July at this point. I see Roger was recommending senior hours at the pool, not senior days. I think we need to get together a better plan, and if it pushes back opening the pool for a couple days, maybe we get together a few people and put out some better guidelines than what we have right now. So that's what I've got to say. Thank you, and I will mute myself again.
Thanks, Diana. I just had some information that came in from the Florida Department of Health, Osceola County, and it does state that although the county opted not to renew the order that was closing the pools, he has a paragraph I just wanted to read. Considering the non-essential luxury nature of pools, that they are public congregation area by designs, I'm recommending to all my facilities that they remain closed until we have a better grasp on the current situation. We are just now beginning to reopen restaurants and other stores in a limited capacity, but these things have to happen gradually to minimize the effects of a potential reemergence of COVID-19. As you stated before, regardless of the current public health situation, the facility should not reopen until the county building department has signed off on the pool. Again, that's from William Venez, the environmental specialist, Florida Department of Health, Osceola County. Again, I think we're all trying and struggling to do the very best we can in this situation, but I know the county guidelines do come into play, so I just want to let everyone be aware of that we may have to have some discussions on the pool.
Thank you. I'm going to ask Mary Ann, are you available? Because she could speak. Diana, you mentioned the Girl Scouts. That's why I was wondering if you have available. Mary Ann, are you available?
Yes, I am.
Oh, perfect. Can you share your thoughts about what's going on with the Girl Scouts and kind of what your guidelines have been so far?
Yes, we have similar types of amenities. Obviously, we're public facing as well. And Diana's correct. We've closed all of our resident camps and day camps. We are looking at what we can do to start letting people back in, maybe in household groupings in July, because we have pools and things as well. I mean, these are really serious considerations. We are starting a phased back plan in the office beginning June 4, but we're taking a very conservative approach, similar to the types of things that Jerry was alluding to when he was speaking. We're taking a very conservative approach in terms of when and how we're going to allow gatherings. I think it's July. If all stays on track as it is now, we'll start allowing gatherings of 10 or more. You know, we're really sticking close. My advice, if you're just to ask Mary Ann what I think is what we need to do right now is we need to agree to creating a phase plan with the dates that we believe, tentative dates that we believe, based on current information, the CDC will roll these out so that we and our community know that there is a plan. Open what we can safely open. I understand people are frustrated, but from where I sit, public health obviously has to be number one. So we are taking a very similar approach to what Steve has here in his plan. We formed ours a little bit differently in a 4-phased action, and I'd be happy to send that to Steve and the rest of the board at some point. But yeah, we're any place that people are going to be sharing respiratory droplets in close proximity, we've shut down through this summer. I do have a question about the pools, because I wasn't sure if I heard this properly or not. If we reopen the pools based on whenever the timing that comes from the county and whatever rules are situated around that, I assume there will be capacity limitations that will be put in place.
I would hope so, but I don't think we've discussed a number. Marianne,
But you do have the authority to put a capacity in place. The question is what residents get. Is it a first come, first serve? You know, if someone shows up above the capacity and they go in, I mean, how do we enforce that? I think those are the questions that have to be answered.
What I would recommend is some priority hours, have some family hours, and some, you know, adult 55 and up or whatever we decide as a group is the right thing to do, hours, so that, you know, I know we think when we make it the senior, when we do senior only, we are trying to protect them from asymptomatic people, but they might bring it in themselves. I mean, but I do think that having some affinity groupings of hours with first come, first serve, that is how, if we had a public facing pool, that is what I would be doing at my corporation.
So let me ask you a question, Marianne. You said you're canceling all activities for the summer where there could be respiratory droplets. I mean,
we have close proximity where there's going to, let's say, we've closed the scout houses. Anywhere where people are going to be sharing air in close proximity, we're not okay with that.
So you mean the indoor items?
That makes sense. So the camp, so here's the thing with the camps, you know, we're talking about resident camp, but there's 8 to 10 to a cabin. So that's different than the pool. Day camp, again, they're doing activities in shared table space. It is not likely we would be able to effectively keep children 10 feet. I will tell you, I went to doing drive-by birthday parties and things. We've had volunteer invites. We do our best to participate in that to support the families we're serving. And when we were in a parking lot, everybody socially distanced their cars, but keeping the kids socially distanced to what we think is a safe distance based on the current recommendations was impossible. They were so happy to see one another. I mean, I think it's just a tough situation, guys. All we can do is the very best guidelines that we can put out there and be as smart as we can and give the proper advice. We can't control people and their actions. We can't. So we just have to set forth the guidelines and try to do that. I'm really in favor of creating a phased plan with tentative dates for how and when. That gives it, because we have to have the time to prepare and plan for how we're going to manage those situations once we open those gates. That's really critical. We can't just say, hey, free for all on Monday with no thought and preparation into exactly what that's going to look like. And that's just my opinion, and that is how we have done it. And I have 6 counties in Central Florida and 20,000 members. Every bit of it's public facing. and public access when we're open. So it's those are the things that we're doing, is we're taking a really conservative phased approach, and we're relying heavily on CDC.
Thank you. Any other, go ahead, Diana.
Mike, I love exactly what Mary Ann said.
We're having a hard time. Can you speak a little bit? Yeah, there we go. Thank you.
Speak louder.
Sorry.
I completely support what Mary Ann just said. I think we need firmer guidelines on what the pool opening looks like. I think if we need to get a group of us together, maybe 2 or 3 of us sit down with Steve and with Nikki and put those guidelines to paper. Whether we limit the hours of the pool, there's a lot of different things we can do to make it so that we can open the pools somewhat. I agree, opening them up without those guidelines is going to be a free-for-all, and it's going to be unsafe, and we don't want to create that situation for our residents. So I'll volunteer if you need someone to sit down and work out guidelines. I'll certainly be part of that. Just let me know. And even if we can ask, and maybe, we can come up with a plan that we'll all feel comfortable with, that we can take a look at. So again, no rush to get, I know the pools, everyone wants them open now, but doing it without the rules in place is going to be it's not going to work.
Thank you, Diana. Go ahead, David.
Yeah, a couple things, just, and I'm offer comments at 2 different levels. One is the micro. I know that we were directed last week to make some decisions this week. So we need to discuss at the micro level, 4th of July and probably Memorial Day, and get those resolved, give management direction. The other thing from the micro level, and this came from Mike's comments about, when we order supplies, why don't we go ahead and order supplies? Because we will use them, whether it's next week, next month, or 4 months from now. So why not have them on hand? Because once there's a rush, then they're not going to be there. So that's the micro level. At the macro level, again, 2 different points. One is, I think we should decide either yay or nay, or modify, or think about it, decide whether to adopt the guiding principles and put that out. And the other part at the macro level is, I've worked on public health for decades. I've only had a few deaths, not as many as Jerry has had. But with my current involvement with this issue and reading the scientific literature and modeling, I think it's premature to open any of our amenities. I think this plan is helpful, but it doesn't have the details that I would like to see, and that I've heard Diana saying and Mary Ann and others say. I don't think it has the details yet. We're dealing with a highly communicable, contagious disease. And I err on the side of caution. So before we move for changing our status quo, I think we have to have it thought through. This is a good starting point, but we're going to have residents who want to weigh in, and I'd rather have them weigh in and then decide after that weighing in. And that doesn't mean today. It means, this is getting posted. I'm sure there'll be something in today's Friday Flash that says, here's the draft. If we have a revision going forward, then have them look at it. I do not see a rush. I too am on day 50 of self-isolation. I'm pent up, and we're all anxious to get out, but I do not want to rush. I value life higher than lifestyle. So I err on the side of caution as we discuss this. And so I would concur with what I heard from Diana. I will vote no. If the vote comes to adopt this plan as is, I will vote no today. I want to vote yes, but it's not ready yet. It's most of the way there, but it's not there.
Hey guys, this is Kevin. Just wanted to go ahead and jump in with a couple of comments. David, I agree with exactly what you're saying. I think we're on the right path to finding a way. But unfortunately, there are a couple of details that are just, I'm a little cautious with.
Yes.
I agree that there needs to be that increase of cleaning. As mentioned in the comments as well, perhaps we learn from our vendor that's cleaning the pools, what they're doing in other communities in our local area. Use our resources that we do have. I understand CCMC, Steve mentioned, he's reached out to other communities in Florida to see what they're doing. And I think that's one of the benefits of being part of a large company with a network like that. A couple of things that I've been running through, both thoughts that I've received here and been thinking since the governor's order. So if we were to open the pools, I would definitely put in place a couple of things, ensuring that we have park monitors there to limit the amount of people that are entering. But timing then turns into a concern. So I go ahead and I'm looking to see what resources we currently have, and I'm hopeful that somebody from management can help me understand a little bit more. But we have a website called RecPro, and if I understand correctly, RecPro is to schedule facility usage. Is it possible, and I have a couple more comments to go ahead and share, but one thing I'd like to hear from management, is it possible to go ahead and use the RecPro software to schedule window blocks for X number of people, whether it be for the dog park, whether it be for this pool, that pool, the other pool, just to go ahead and help us get a gauge and a control. And essentially, I don't want to make it a you got to be on the list kind of a situation, but we need to find a way to properly manage while opening in a safe manner. I agree that senior hours or something similar to go ahead and assist, like we've seen in the grocery stores, as long as that, you know, is completely legal, which I don't see any concern because we've seen it throughout the country. I would want to see if we could do things like that. I am not in favor of the breakout at this time if we needed to go ahead and give a yes. However, I would be encouraging management to come up with some kind of a last minute, smaller, modified version. If June comes around and things are great and everything is open, well, we can go ahead and do a smaller session of breakout. And then final comments are regarding the management. I would just like to hear how they will monitor. That is 100% Steve's wheelhouse to go ahead and give us the information. So how is he going to monitor it, keep in touch with other Florida communities, and I believe those are all of my comments. Oh, and finally, of course, the 4th of July. I'm a hard no on that based on the groups. And the board did receive an email this morning that I found out the car show itself has been postponed until November as well. So we are going towards that direction of avoiding large groups downtown. And those are my comments. Thank you.
Thank you, Kevin. Is Debbie, did you have any comments that you wanted to make? I just want to make sure all the board members have their comments. Okay.
I'm muting, sorry.
Oh, there you are. You're good?
Yes.
Go ahead.
Yes, I've been a hard no on 4th of July. There was a very,
wait, Debbie, Debbie, just a second. We're having a hard time hearing you. Can you speak up, please?
I haven't changed anything. Can you hear me?
Yeah, you're good now.
Okay. I did receive, I think, a fabulous idea from Kathy Whitmire, who's been a long-term member of our community and a teacher at our K-8, about some type of a thanks parade on a small scale where she has already cleared through the middle school and high school to, they would take charge and distance the kids, and something maybe on a simple scale, obviously no fireworks or large gatherings. We can discuss that later, but I just wanted to acknowledge that and thank Kathy for proposing that and joining us. I think all of us are obviously, I know the board is extremely dedicated to doing the right thing on this. We are all very passionate about the concerns for our community first and foremost. I think that these things came through quickly and late, in my opinion, to have enough time for either management or the board to make the details. I think the overall is good, but the details have a lot to work out. I am available over the weekend if we want to try to push for something sooner, but I think we do need more time. I don't feel we're ready. I think we're going to need, as I said before, all hands on deck, whether that be taking temperatures or limiting people or scheduling different things. We're a smart community, we're creative, we can figure it out, but I think just flying open with the pool doors with no one there to supervise is going to look like California beaches on a small scale. Thank you.
Thank you, Debbie. I'm going to go ahead. If a couple of things, I think. Oh, I'll get you 1 second, Diana, and then I'll grab you. A couple things that I think we can do now, though, is like we need to discuss. Can we go ahead and open up, the 851 building as they've outlined? So let's go through things that, as a board, we feel yes, we're ready for these items. Then, because I think we all agree that pools, things like that, we just don't know what that looks like. But I think there are some things that management can go ahead and open up on Monday. So Diana, I'll go ahead and open it up to you. Go ahead.
That was exactly where I was going to take the conversation. I think there's things that we can all agree on that we're ready to open. So do you want me to put that as a motion and go for a vote?
What I'll do is, why don't you go ahead and go for a motion, and then we have a hand from a resident who's been wanting to go ahead and speak. So go ahead and make your motion, and then I'll go ahead and take comments from the board, and then also from the person that has their hand raised.
Okay, I would like to make a motion that we adopt David's plan for the overall guiding principles for opening our community amenities. And go ahead and, I guess I'll make it a long motion to go ahead and open 851, the tennis courts, the open area parks, and the dog park, effective on Monday.
Okay, so we have a motion, for those that couldn't hear it. We have a motion to adopt David's recommendations for the plan of opening. We have a motion in that for opening the 851 building as outlined in Steve's recommendations. Is that correct? The open park area, the tennis courts, and was that it?
And the dog park.
And the dog park, thank you. And that's all based upon with the guidelines that Steve has outlined.
I agree, yes.
Okay, and do I have a second for that?
I'll second for discussion.
Thank you, Debbie. Okay, I'm gonna go ahead. Is there anybody that would like to speak on this, or do you want me to go ahead and take the person that has been waiting very patiently with their hand raised from the beginning? David, go ahead, and then I'll open it up.
I think it's conflating. I think it's confusing to blend all those together. I think my discussion would be, let's decide on the guiding principles or not. Let's decide on 851 or not. Let's decide on park areas or not. So I will vote no, because I don't like all of those together, because some of those
Diana,
I would vote no on.
Let me redo my
do you want to amend your motion and just take it one at a time then?
I will amend my motion I make a motion that we adopt David's guiding principles for reopening. And
I'll second that for discussion.
Okay. All right. So we have a motion from Diana for opening for the guiding principles, and we have a second from David. Do I have discussion from the board with regards to the guiding principles?
Yeah, I again support those with the removal of the employee and community member health concern paragraph, but and possibly David can reflect this more. I do feel that we need some more information in there for the community from the management company for guidance.
I think as the board's voting on this, I can just work with, I was waiting to get board direction on David's recommendations, and that's why I put the draft watermark on these recommendations. But if you guys want me to just work with David on updating and modifying based on his red lines, then we can do that.
But those are two different things. My guiding principles are standalone. But
the guiding principles will become part of the opening plan, right?
Yeah, it's part of that. But then there were other elements that each of us have for your 10-page plan. I think we're just talking about those nine guiding principles.
yes, that is all my motion is the 9 guiding principles. It's not the one that's on the screen currently. It's the previous one from David's email.
Oh, okay. So we're talking about David's email, or you're talking about?
We are talking about David's email.
Okay.
Principles. We are not talking about.
Is it possible to put up what we're
Patrick,
talking
can you
about?
switch that back?
Yeah,
it was up early. We'll pull it back up again. Okay, so we have a motion and a second for the guiding principles. Do we have any conversations with regards to David, can you post that up?
So everybody can see it.
Oh, there we go. There it is.
There you go.
Can you just scroll?
That's all 9.
Yep. There we go. Okay, perfect.
Yeah, that's
We're good.
It's included in my motion.
Right.
What's your motion?
Okay, and then David, you seconded, obviously.
I did. Yeah.
Any further discussion with regards to the board on this?
I'm in favor of David's guiding principles. I would just like to go ahead and have them added to the minutes.
Agreed. Anyone else? Okay, I'm going to go ahead and take the person that has been patiently opening their hand, because I want to make sure that, that we don't lose. So I'm unmuting the person who has their hand raised. Hello, person who has their hand raised. Hello?
Vanessa, this is PJ Cartwright. Is that me that you're talking to?
It is you, PJ. Thank you.
I only had a comment, two comments actually. One with regard to the pool. It's really, I think, important that we talk with our pool vendor because the checks that are done on the public pool may have to be increased. And that would require, I don't know if we have someone on staff that has a CPO license or not to pull that. It's not required that they have a license to do the testing. Anyone can do the testing, but it probably should be done on a more frequent basis. And I say this as a former pool operator. And the other thing is with regard to the bathroom closures, I remind everyone that the number of bathrooms that need to be open are directly relatable to the occupancy of the pool. Our pool occupancy is a lot higher than the minimum. So, but I think the minimum now under the current law is 20. So, you can still have just one bathroom open, a unisex bathroom open if you have limited the occupancy of the pool. I personally do not think that we should ever open a pool in the areas where we have pools without sanitary facilities being available. Whereas without that being available and kids in the pool, we're looking for a disaster in the making. It's hard enough sometimes to get the kids to use the bathrooms, let alone having them get out and go home. It's just not realistic, and it's going to be a problem. And the other thing I wanted to just mention about the dog park is I'm really glad to see the dog park included with the open park areas as we go to and from our home on a very limited basis in our car. We do see that people with pets are utilizing open spaces, i.e. sidewalks and other open areas now. And they are being very responsible for their pets and whatnot. And personally, I do not think that reopening the dog park is any different than opening a sidewalk. We monitor it, the size is monitored. We can, it's very easy to monitor that load size because the number of users in the dog park on an ongoing basis in the past has never been what one would call a large group, So that's just my only comments, but I was more concerned about the pools.
Thank you, PJ. I'm going to go ahead and mute you. Are you all set?
I am good. Thank you for letting me have my comments.
Absolutely. Thank you very much. Okay, board. We have the motion and a second with regards to the guiding principles. We'll go ahead and take a vote. I'm actually going to do just a poll. It'll be easier so we know who is a yes and a no. Debbie, are you a yes or no? Let me unmute you.
What was the question again? Sorry.
It's about
the motion.
Yes, the motion is to approve the guiding principles as written by David on the 1 through 9. And that was a motion from Diana and a second from David. So Debbie, are you in favor?
I am.
Okay. Kevin, are you in favor?
In favor.
Diana?
Yes.
Kevin? Oh, yes. Marianne?
Yes.
Brian?
Yes.
And I think Debbie was a yes. Kevin, David, you're obviously you've motioned.
Yes.
Are you in favor?
Yes.
Okay, and then I'm a yes. And I think I've got everybody, right? Okay, so motion passes. So the next motion then that we needed to find out is how do we want to proceed now? Do I have a motion for the next comment?
I'll make a motion to open the dog park on Monday.
Okay. Do I have a second for opening the dog park on Monday?
I'll second for discussion. This is Mary Ann.
Okay, Mary Ann, second for discussion. Board members, and I'll get whoever is on the iPhone there in a second. Go ahead. Board?
I'd like to, before I would approve anything like that, I want to see more detail specified, which I don't think we have yet.
Any other board?
This is
Mary
Ann.
Ann.
Go ahead, Kevin. You go first.
Oh, thank you. My big thing is, as if management can go ahead right now and kind of give us a quick overview of how they're doing that safely, I'm happy to go ahead and support opening it. I would just like to hear the safety of the crowd control, how it's being monitored, if we'll have, you know, hand sanitizer stations entering, things like that. I just need to hear a little more information.
Let me just say this, folks, management nor any of the board members can guarantee anybody any safety when it comes to COVID-19 or any other situations that are taking place within the community. So I can't do that. It's a little bit over 3 acres, the dog park, and even at the busiest time, social distancing can easily be practiced at 6 feet. You can't keep your dogs 6 feet from each other. They'll certainly interact with each other, but if you're going to open the dog park, there's plenty of space in there for people to stay 6 feet away from each other.
I think people are anxious to open the amenities, but I think management needs a little time. I agree. I am ready. I think everyone is very anxious to have some things open. But what we talked about yesterday, and for everybody, there was an executive session where we had some discussion yesterday. What we talked about then is we do have personnel. We have personnel working from home. I think during the transition, whether that be the first few days or the first week, I would like to see staff on hand from Parks and Rec to help guide people coming in that aren't attending this meeting, or perhaps haven't been watching as much news or aren't as concerned or aware, to give them some guidance for the first few days just on the transition. How many people? Normally we don't have a crowded dog park, but with the only amenity being open and the first amenity being open, I don't want it to look like a beach.
Other comments?
Yeah, Vanessa, this is Brian. I guess, you know, my issue is not the dog park. My issue is, I think, you know, Steve had written the general big picture guidelines, but it almost, as I'm listening to here and I'm reading comments and stuff like that, it ought to almost be like, okay, if we're going to open the dog park, maybe we're going to open the dog park on Wednesday, just to pick a day out of the blue. And then it's almost like we ought to have an e-blast. Okay, the board has decided to open the dog park, and here are going to be the rules around the dog park and the personal responsibilities, but then what are we going to say about masks and stuff like that, to avoid this rush and everything like that. Because how are we going to communicate what we're doing and what, because everybody won't watch these videos, and word of mouth will lead astray. So I think we need to know how we're going to communicate it. I think opening the dog park makes sense. I just think we need to have clear communication of the rules to the community. And it'll be the same thing when we go to the second thing and the third thing.
Any other comments from board members?
Vanessa,
Okay,
can I just also add, there's no law or order that says that residents have to wear a mask. I understand it's a best practice. I understand it's probably for your safety or other safety of others to wear a mask. But if we say open, we can't require people to wear a mask unless you say we're not going to open the facilities at all if people are in there without masks. I mean, our enforcement when it comes to a homeowner association is to fine residents. These aren't finable offenses. So then the next level of enforcement you have is either you just close it down completely. You say residents aren't complying with the guidelines we've set up, so we close it down completely.
I mean, I think, Steve, my point is we had a grand opening for the park, and we had several staff members there and a lot of board members and a lot of people from Parks and Rec. I'm just asking for a simple transition. I don't understand, like, for a day or two why we can't be there to celebrate the opening of this and see how it goes for some other amenities, and it would help us possibly with how the pool would work and maybe get that on board sooner.
I could certainly put a staff at each one of the facilities that we're opening. again, we can encourage people. We can say, hey, it's probably a good idea to wear a mask, or you need to stay 6 feet apart from each other, but there's just no enforcement. But we can certainly put a staff person there.
Yeah, none of us have any enforcement. I think we're all just trying to do the best we can for the safety of the community. But I do think that having a presence with our management company is a good idea for a transition, if others agree.
Anyone else? Board comment?
Is anyone offering to modify or ask Diana to modify the amendment to instead of being Monday a little further down? That's kind of what I'm hearing people leaning into. Is that, am I assembling the information in my head correctly?
Arian, why don't I withdraw my motion and have someone put out a new motion regarding the dog park? So
do you think that's necessary? We could make an amendment to the motion if you're.
I can amend the motion to say open the dog park at a future date next week with stated guidelines and a staff monitor. How does that work?
I second.
Okay. I think is it possible to make sure we have just things to clean there? That's my biggest issue. You need to have hand sanitizers at the site. That's my biggest concern. Can we have hand sanitizer there?
Yes, I can put a hand sanitizer station at the dog park.
Okay. And then I think that will at least provide an opportunity for people to keep their hands sanitized as they're coming and they're going. Any other comments from the board? And then I'll open it up to the person that is raising their hand nicely.
Yeah.
Anyone else? Go ahead, David.
David, I still err on the side of caution. I'm not ready to rush into this. I think we have other items that we need to finalize first. I mean, opening 851, I think, is a higher priority. Opening park areas is a higher priority. So I am, until we talk through, I'd like to see a plan in writing and then have us talk that through before I support opening the dog park. So I remain a no on this for the time being. As much as I'd like to see it open, I don't think we're ready, and I think it's rushing things.
David, do you have a suggestion for what we would need to do prior to reopening this and what we could do or get together as a board to do?
No, I'd turn to management to write up some of the thoughts and we talk about it in our next meeting. I still think we need to talk about 851 and park areas, and we have to talk about 4th of July and vote on that.
Right, we do have other, are we able to table this and get together Monday or Tuesday, board members? As opposed to
That's
waiting
hard for me because I'm still working.
I think we postpone this till next Friday.
Okay.
Is it possible, this is Kevin, is it possible to, and I know it's the weekend and nobody wants to do it, but if management can go ahead and take 48 hours to really develop a plan and get it back to us on Sunday, perhaps we could find a slow opening. I understand they're under the pressure because the governor opened up yesterday and a lot of questions are still there. But I'd rather just keep this conversation going so we can be educated and go wisely.
And let me just add, management has put together a plan. This is the draft plan based on the guidelines that we have. At this point, this is the one voice direction of the board of how you want to open these facilities. So I would recommend that you push it to a meeting next week. We extend it beyond an hour, make it a half-a-day meeting, workshop if we need to, and let's walk through and get one voice direction on how we want each facility to open. I don't have a best practice for how to open a pandemic facility because nobody's ever done it before. All I can go to is NRPA, the Florida Health Department, the CDC, the state, and the presidential plan. That's all I have available to me to look at. And then what other communities are doing. But you're going based on what their boards have voted on.
Okay, here's,
so
I feel like we're kind of spinning. Give me 1 second here, Steve. I feel like we're spinning. It doesn't sound like we have even 4 board members that are in favor of opening up the dog park based upon the conversation here as the motion is. So let's backtrack. Some things that we know for sure that we can have a better conversation at, and something the board needs to implement for Steve in order to take action are things like, what are we going to do about allowing staff to go back on Monday, right? That's something that he needs to know. We already have a plan. We've discussed it. So can I have a motion? Well, let me backtrack because we still have the motion and the second. Do we want to let the motion die, or do you want to withdraw it, or do you want to continue on and have an official vote?
Do you want to just take a vote on it?
Sure. Okay. So, Debbie, are you in favor of motion as is?
I have to be reminded of what it says.
Okay, that's fair enough. It was a motion to open up the dog park on Monday with social distancing, and then we'll have hand sanitizer and things like that out there.
I think there was also some guidelines requested in there that I think
Wasn't there an amended motion?
Yeah, the amended
there was
motion.
an amended motion.
Yeah, the amended motion did not give a specific date, but said next week with safety guidelines in place and a staff monitor.
The reason why I'm going to speak, I'm comfortable with that, this is Mary Ann, is because we don't need to micromanage how staff makes that happen. We just need to say that's what we want to happen. Steve and the staff at CCMC are perfectly capable of coming up with that plan and enacting it. We just need to give the direction. And so that's actually a motion that as it's stated that I feel I could support.
Okay. So yes from Mary Ann. David?
No, and part of it is also that implies a full-time staff monitor, and so I do not support that.
Okay. Kevin?
I will be a yes, based on what Marianne has stated. I would just like to go ahead and receive an update throughout the week of how things are going, challenges that we're having, and use this as our learning for opening up celebration and the other amenities.
Thank you. Brian?
I am a
Debbie, I'll get you. You're a yes. Debbie, go ahead.
I am a yes, and I didn't request full-time staff monitoring. It was a transition. There are 2 times the parks are fairly busy, or the morning and the evening. And again, it's not full-time staff monitoring, it's a transition. And I think we just need some guidelines, so I'm a yes.
I think just to be clear though, Dave, before you do it, just to be clear, the motion is strictly based upon what management wants to, how management wants to implement that, but they'll take board member feedback into hand. That's the motion. Go ahead, Brian.
No, I agree with what Debbie said. I didn't think it was a full-time person. I thought it was somebody who was there part of the time, carefully monitoring things just so we had feedback. So, but I mean.
All right, and I'm a yes. Did I miss anybody? I think I got everybody.
You didn't ask me.
Oh, I thought you said yes. Were you a yes?
Oh, I did, I had a point, now I forgot it, darn it. But I'm a yes, and I'm a yes because we have to start somewhere, and I think the dog park is the safest start point for us.
Okay. Thank you. So everybody was a yes with David as a no, given the safety situation. So fair enough. All right, so next, I think we need to go on to, well, let's do another easy win, right? Let's do 4th of July.
Vanessa, can I ask real quickly, for the 851 building, what we're requesting is just staff would come back to work. We'll follow all of our safety precautions that are being asked of by CCMC and whatever requirements that the governor's put out there. And then we'll open the front desk, the counter, to allow people to get their IDs. They can pay assessments. They can get their parking decals, whatever, buy merchandise, whatever. But we'll only have one inside the building at a time, possibly 2 with that 6-foot distancing, and then other people in a queue. If we can do that, and then I also like to recommend a work session on Monday, to where we can get everything else worked out, because I have a feeling the 4th of July is going to be another 35-40-minute conversation. So I would really like to give you guys the opportunity and the time, and we'll have the increased number of participants too for Monday. So it's up to 1,000 now that we can take.
All right.
Okay, thank you.
I make a motion that we open the 851 building on Monday in keeping with Steve's guidelines.
I second.
So I'm sorry, who was, Diana, was that you the second? I'm sorry.
Debbie,
Thanks.
either one.
Okay. Okay. I saw Debbie, I saw Diana's face. So we'll go Brian motion, and then Diana had seconded. Discussion?
I am very happy that building is reopening. I think a lot of people, just a reminder, as the dog park is opening, just make sure you have your proper paperwork and your ID up to date for the gate for opening.
Yes.
And then the other comment on the APID dwelling building is it will not be open for meetings or lifelong learning or any of those other programs at this point in time, just to be able to have the business of the front desk open.
Okay. I'm going to go ahead, and the person that is raising their hand right now, I do not know who it is. So I'm going to lower the hand, and I'm going to unmute wherever it went. Uh-oh, I just lost them. Can you put your hand back up again? Sorry. It's a cell phone. I don't know which one. There's a whole pile of them. Whoever had their hand up, there we go.
That's back up.
There we go. Perfect. Okay, so I will unmute you first. You are unmuted. Could you identify who you are, please?
Yes, Vanessa. This is Celia McFadden, 1007 Celebration Avenue. How are you?
Good. Thank you very much.
I'm a little confused about this whole meeting today. I know you guys mentioned that you didn't get all the information until yesterday, right?
Correct. We have the guidelines. We've been working with Steve on the guidelines and comments just through our Friday calls, just kind of giving some feedback to him. But yes, we all received it after we received the information from the governor specifically, and then yesterday we received the guidance from the county.
But shouldn't this have all been done before you even got all the information? Like, it seems somebody's unprepared somewhere, and you have a lot of residents like are very itchy to get back to their normal lives. And even though everyone is concerned about the health and safety of our residents, and we don't want to undo everything that has been done, it seems that all these people on this Zoom call today that have come on here are going to be a little disappointed that no one was prepared for this. You started off the meeting saying this is what we're going to open, and then it went all the ways back to square one.
I'll share a little. Thank you, Celia. I'll share a little bit
more
of.
thing.
Go
if
ahead.
you were in town last night, if you were in town last night, you would never know. There was not one parking spot available anywhere. The town was open. Like there was no concerns. There were people that had masks on. There were people that didn't have masks on. The people are in town and doing what they want to do. So if you open the pools and you have the sanitary stations, of course you can't close the bathrooms, otherwise you'll have people going to the bathroom in the pool. If you have all of these things in place and signs in place, which should have already been taken care of. These signs should have been printed. Everything should be in place. There should have been stuff ordered already for the future. If you don't open the pools, or if you do open the pools, if people don't want to go to the pools, then they don't go to the pools. But if people, even when the pools were open, you could go to Lakeside and maybe 20 people would be at the pool to begin with. You could go to Spring Heritage Hall and maybe 30 people were in the pool to begin with. People can definitely social distance themselves if they want, but nobody's social distancing themselves in town during the week at night, every single night. People are walking around, riding their bikes, having their own private little gatherings in town, sitting at the tables where all the restaurants left their tables out. And it's just like people are out there. People want to get back to life. And it seems like this meeting went from a positive note, the first 10 minutes of it, to back to last week. And it should have been prepared a little bit better. These signs and sanitary
I'm going
things
to call the
should have all
question.
been ordered.
Yeah.
3 minutes. That's 3 minutes. Sorry.
I'm actually, thank you, David. I am going to say, it's really quick, Celia, thank you very much. I do appreciate your feedback. I think it's important that all residents understand, just as much as we have all of this dialogue going through on our text feed, which it is public record, so we will have all of that. I think it's important to recognize that just like nobody on these feeds agree, I've been all 7 board members. So yes, we have had all of these things, but you can hear just from our dialogue that there's no consensus in a lot of these things. So therefore it's more confusing. So this is unfortunately your governance at work, whether it's a joke or not a joke. It is what it is. I think it's important that I appreciate everybody's dialogue, but I do ask that you at least be respectful because we are not paid. We're working hard to make sure that your safety and security is being at our utmost thought. And I agree that you pay your assessments. So do I. So does everybody else on the board. We want to make sure that we are not putting anyone in jeopardy. More importantly, as a CROA board, we are legally bound to make sure we're making good choices. So I'll open this up. Mary Ann, you said you wanted to say something.
Yes, I do. And I hear and understand your frustration with this, Celia, but I'm going to share this with all of you as someone who's running a business through this right now. We have contingency plans and we've talked about things, but this is unprecedented. No one, not a single one of us, has lived through and run a business or a community or whatever through this before, okay? So that's why it may feel unprepared, but we're talking about weeks here, not months, and not yet, yes, months, but from the time where we said, oh my gosh, we need to follow the guidelines, here's what's happening. It feels like forever to all of us. I can tell you that it does to me, but in real world business preparation time, we've been talking about this, but until the governor rolled out his plan, until we see the daily changes that are happening in this, it's very, very difficult to be like 100% prepared to do a next day go. I absolutely get it. I'm in there with you. We wish we could, but so it may feel but to make preparations for when we're not sure exactly how we're going to have to do the rollout based on all of that external information that's coming in and external guidelines that are coming in. So that's why I'm going to say, be patient, be kind, be productive in what we can talk about here. And that, Cecilia, by the way, that be kind, and it's not directed at you, but because you are always productive and kind. I want people to understand this is not as simple as it might appear. And I speak to that from experience and not just because I sit on the board and I'm trying to be a part of rolling this out. It's hard. This is hard to do. So that's all I really wanted to say is it's difficult to see some of the comments that are rolling through right now when you have people who are trying to run their own life and their own business and also do this on the side. Recognize that we feel everything you feel.
Thank you, Mary Ann. Any other board, and then I'll open it up to the resident that has their hand up.
This is David.
Go ahead.
We're still on 851 building, opening 851. I think that's the motion, correct? So I had two items, both of which I wrote yesterday when I read the plan. First is, will there be, or if it's not on Monday, will it be shortly thereafter? Will we have some glass or plexiglass divider separating the staff from residents or from guests? And then the other is, should the water fountain be operational? That's a question, because I've read some different points of view about water fountains, both indoors and outdoors.
For the first question, if the board wants to invest in plexiglass 851, we can certainly do that. The countertops, I don't have the exact distance. I believe they're three feet apart, but there's also a separation. It's a different room. So the front desk staff can stay back 6 feet, and we can put the X in an equal distance away so that no resident is closer within 6 feet. And then we'll have masks for those front desk members also.
Steve, that's a great idea. From being back in that area, you do have plenty of room, and you could even have a queue with 3 people if you turn towards the door, but 2 or 3, whatever you decide.
Yeah, and we'll definitely ask for everyone's patience as we work through this, because we'll only be able to address one resident or guest at a time, and then we'll have to have everybody else wait in queue. And I know it can be frustrating, but we'll just have to ask everyone's patience for that.
Got to figure out your own plan on what do you think is best practice there.
Yeah, and I don't
Thank
know
you.
that a plexiglass is needed, but again, if the board would like to invest in that for the building, we can.
Why don't you you all decide, talk that through, and figure out whatever configuration you need to, just to be safe. That's the main point.
Thank you. And before I open up to the resident that has their hand up, is there any other board comments? Okay, I'm going to unmute you and lower your hand. It's all you. Whoever had their hand up. Hello? We are unable to hear you. Ah, there we go. I hear somebody with a doorbell and dog barking.
It sounds like they're not ready to.
I apologize. That was a good and needed comic relief moment there.
Okay, go ahead. Are you all set? Whoever is on the phone? Okay. I think I'm going to have to mute the person if they want to come. Ah, okay, your hand's up. You're all set. You're up. You're off mute.
This is Celia again, Vanessa.
Oh, thanks, Susan. All right, thank you, Celia.
Okay, just to clarify what I said about being prepared. I know you guys as board members are very on top of this, and I wasn't referring to the board not being prepared. These things should have been ordered ahead of time, like maybe 3 weeks ago. Hand sanitizers, signs, everything should have been done 3 weeks ago or
We
longer.
will be prepared for that. We'll have hand sanitizer. We'll have signs. We're prepared. When the governor did his,
Steve, I think a lot of that is already on. Steve, just really quick, we already have a lot of that stuff, correct?
Okay.
Correct, yes, that's all part of my recommendations.
Okay, I'm just want to clarify that I was not saying that the board was not prepared. It's just the way it comes across that all of these guidelines and everything maybe should have been communicated to the board or before this meeting took place today.
I hear you. Thank you very much. And just
Vanessa,
to be fair to, yeah, I was just saying, to be fair to, go ahead, Steve.
Well, I just want to add, for those that are watching or will watch later, the governor did his announcement at 5 o'clock on Wednesday. I modified while he was talking, and then after, sent it back to my staff and gave them to the next morning to give me any updates that they'd have based on that information. As soon as it was done, I think it was like 9:45 yesterday morning, I sent the plan to the board. So I don't believe at all that it's a lack of preparation by management or the board. I think that we're working with the guidelines that we have in front of us, and they're all spelled out here in Dave and Mr. Anderson's guiding principles and in my recommendations. At this point, we just have to work through what the board's comfortable with, and it's absolutely to the board's discretion on how they want to open these facilities. So if we can get the guidelines on 851 and get that open, and then next I'd ask for tennis courts and open areas. And then I think we need a full 3-4 hour workshop on Monday to work through the rest, but we have to get that done Monday as quickly as possible.
Can we call the vote?
All in favor? I'm just going to do a quick blank in here. So we've got Brian?
Yes.
Marianne?
No.
Diana?
Yes.
Debbie?
Yes.
David?
Yes.
Kevin?
Yes.
And I'm a yes. Marianne, I understand where you're going with this. I totally respect that, by the way. So I understand where you're coming from. Just to be quick clarification with regards to hand sanitizers, things like that, we have that in stock already. So I think the things that we're looking at now is just as we open it, how can we get it to whatever area it needs to be delivered to based upon the board recommendation. So I just wanted to make sure that that is that's just clear to everyone. We do have things to roll things out, but we may have to just shift things, hand sanitizers and cleanliness things according to how we open. So just wanted to clarify. Okay, do I have another motion? A motion passes with 1 no. Do I have another motion?
Was it 2 no's?
Oh, it was just 1 no.
Okay.
Yeah, it was just Mary Ann.
Okay, thank you.
Do I have a motion?
For tennis courts and open areas.
Yeah, I would like to make a
go ahead.
motion to open the tennis courts and the open areas with proper hand sanitizers posted and signs.
I'll second that.
And hand, wait a second, Debbie. I just want to make sure we got it. So it's proper. It's opening the tennis courts and the open park areas. And open
And
park
I can
areas.
put hand sanitizer at the tennis court. I cannot put hand sanitizer at there's 50 plus parks throughout the community. I can't put hand sanitizer at each one of those.
Agreed.
Fair enough. So,
but tennis courts, absolutely.
Okay, let me
so
finish.
hand sanitizers at the tennis courts
Yes.
and open areas will not have hand sanitizers, but will be open. Is that correct, Diana?
Yes.
Okay. Do I have a second? Okay.
I second. And Steve gave some very clear guidelines on the tennis court opening that I thought were excellent, and possibly we can add those in for the dog park, something of that nature. But yeah, those were great. I second it. Thank you.
Yeah, and Debbie, just on that point, those are from the United States Tennis Association, and JR has already prepared a sign for that, so we'll have signs posted for that.
Great, thank you. Those were great.
Thank you.
Thank you. Any other board comment?
Yeah, this is Brian Kipsel. I'm a golfer, and the golf course has done an extremely good job of doing the recommended things, making sure signs are out, also making sure that the different golfing groups are communicating everything. It's worked very well. So I think the tennis group with the signage you discussed can also do a good job. We got to trust people to be adults. So I think it's great.
And just as a side note, with regards to the tennis courts, I mean, when you're playing doubles, you're not going to have any more than 4 people on each court anyway. So it's within the 10, for gathering.
And
any other comments from board?
Yeah, this is David. Just to be very, very clear, when we're talking about open park areas, we are not talking about playgrounds. We're just talking
not playgrounds or the field complex. That would remain closed because that's a field rental for large group or activities. So that would remain closed, and the playgrounds would remain closed. Just the open green space.
The open green space, the unfenced open park areas.
Correct.
This is Kevin. Steve, could you give us some information about our vendor that we have for tennis? We have a contract with a vendor for tennis, don't we, for doing lessons or something? Vanessa, you might
be able to. Yes. Yes.
And what will they be back in play? No pun intended.
Yeah, and they have some guidelines that USTA has given pros also. Things like participants don't pick up balls. They have a big tube that they use to pick up all the tennis balls. When to change out balls. So they have all kinds of USTA regulations for that.
Okay.
That was included in your guidelines too, that you submitted to the board. And I don't know if that was what was posted, but it was included in that too.
And I've talked to other tennis pros too in Seminole County that are pros in the area, and they're following those same guidelines. So that's where we got this from.
Any other comments? Call vote. All in favor? I'll just do roll call. Brian? Okay, a mouth to yes. I heard.
Yes.
David?
Yes.
Debbie?
Yes.
Kevin?
Yes.
Mary Ann?
Yes.
And Diana?
Yes.
And I'm a yes. Okay, so open areas and tennis. Thank you. Good God, my brain is getting fried. Sorry, guys. Do I have another motion?
Vanessa, can I ask that the board do a workshop on Monday to go into detail on summer camp, 4th of July, and the Memorial Day? Because I believe it's going to be a long conversation. And again, Patrick's purchased additional license so that we can go up to 1,000 residents that can participate. So I think that there's some detailed discussion that needs to take place with those items.
Very good. So right now, based upon the direction you have from the board, is this where you were thinking you needed to be for today, other than the 4th of July?
Well, just to recap, we'll be returning staff to the building on 851 building on Monday. Tennis, dog park, and open fields will open. We'll have staff monitors and we'll have hand sanitizers at those locations with our signage out into the community. And then on Monday, we really need to get into what we're going to do with those events.
Okay. Do we need to do anything with 4th of July now?
Well,
I do have one question regarding the 4th of July real quick that you might be able to answer in your comment right now. I believe there was a 60-day cutoff for certain vendors or contracts. And just doing quick numbers right now, I don't know if Monday
I'd like to do it now.
So May 15th was our time, but if you want to do 4th of July now, that's fine. We have time, but
I think that's a fair conversation to do 4th of July now. I think the board consensus is pretty much we don't want to go forward to 4th of July. So
Right.
I think that's something that's an easy win going forward, and it provides some ease for the population at large.
And we
Are
talked
we good
about
with that,
that a lot.
board?
We talked about that a lot last week.
Yeah.
Right.
So let's
But
at
there is,
least get that one off of our plate. Do you have a motion for 4th of July?
I motion that we cancel 4th of July and refund all the deposits, or get a refund on all the deposits.
Can we clarify that motion, Debbie? Are you talking the parade or the evening event or both? I'm just seeking clarity.
Yeah, I'm sorry. I'm just talking about the event under contract. Brian, you go ahead because you probably know it better. Go ahead with the motion and I can.
well,
Can I make a
and real
comment
quick before you do,
Wait just a second. I'm going to backtrack a minute. Go ahead. Mary Ann, go ahead.
Yeah, I just wanted to say that we probably need to be cautious about putting the deposit language in a motion because that's more operational and probably doesn't belong in the motion. Just because that could, if there's something that happens that we can't control that makes that not be a truth, then we have a problem. So I would recommend not putting, obviously, yes, that's the direction we want them to go, but I would recommend not putting that in a legal motion.
I agree
That's
with
all.
that.
and can I add some more for clarity? I think that when we talk about 4th of July, a parade is going to be a large gathering of people outside if we hold a 4th of July parade. So to me, I don't see a difference between that and a show in the evening time. You're still going to have a large group of people gathered. So I think you should consider them both together. But I also think what needs to be considered is we can move the entertainers that we have on 4th of July to Founders Day. And the fireworks that were being paid for by our program partner, or by the partner for that evening was Lexan. They said that they'll still pay for them if you want to move the fireworks to the November timeframe also. So we have that opportunity available to us.
Yeah, I don't
I'm
want
happy
to
to make the motion if you guys would like. And I'll make the motion that we, at this point, we are not having any events on the 4th of July. That is both day and evening events due to the current safety and the climate with the safety.
Concerns.
So Susan, you're great at making my words pretty. You can go along the lines of that.
Sorry, I'm on mute here. I muted myself. Do I have a second for Kevin?
A second.
State that because it was difficult to hear them.
I think he essentially said no events during the day or the evening on 4th of July.
I'm not, no, we're just talking about, Kevin, if I can clarify, that's for the July. What we're talking about, just a clarification, what we've been talking about is not the parade or anything else. We've been talking about the actual 4th of July event with the bands and the fireworks and the contracts that reflect that. So I would like to separate the motions, leave the parade out of it.
Okay, my motion is for the full date, no events, whatever
including the parade, right, Kevin?
because of gatherings.
So,
yeah.
So just to clarify then, I just want to make, before we get the second, so your motion is that you would like to have no events, meaning no parade and no fireworks or evening that sponsored specifically by CROA. I just want to clarify that because we can only control ourselves.
Yes, we could always, at this time, based on deadlines with contracts, that is my motion.
Okay, thank you. Do I have a second?
Kevin, I'll second, but can we clarify out based on the contracts. So we don't have any contracts with the parade. Can we leave that out and discuss that later?
Yeah, but the problem is you're going to have a crowd on top of each other. I thought that's what Kevin was
We're
driving.
just taking things one at a time, one at a time.
Well, I think if we're good, I think if we have a second for what the motion as it is. Do we have a second for the motion as it is?
I'll do a second.
Thank you, David. Okay, now we'll open it up for conversations. Okay.
My only comment further would be I would not be in favor of postponing any current contracts or vendors to November. And I say that because 6 months ago, we didn't know we'd be here. So I don't know where we're going to be in November. I'd rather go ahead, if we are in a healthy climate, go ahead and go down from beginning to end. But I don't want to transfer funds that really would be best in our pocket over somebody else's at this time.
I agree with that.
Just so we're clear, David, can you clarify? I know, Brian, you're the one that signed the contract for this because you were the president at the time of the decision. So I will defer to Brian with regards to the deposit. I don't believe we have any deposits down. However, we have a signed contract.
We have no deposit down. I mean, JR's on the phone. I mean, we're not deferring our funds. We don't have any funds that come back or anything. I mean, all that Lexington is doing is saying that they'd be, and that's who's doing it, is because they pay for the fireworks. They say they'd be willing to do the fireworks at a later time, being Founder's Day. And JR in the entertainment, I think, is hearing that they can defer it. Maybe there's a small deposit. I don't remember, but JR can tell us.
Just to clarify, I did see a deposit, I believe it was $3,000 that we needed to give notice, not the 3,000, but it was this, the third deposit for, I believe, $1,500 for an entertainer that needed 60 days notice to get a refund. If JR can speak to that.
Steve, JR, do you want me to unmute JR? Or is
yes, please.
I'm trying to find him. Sorry. If I can get some help with unmuting.
Or Patrick, whoever can find him first.
Oh, we got him. He's unmuted. We're good. Go ahead.
There are deposits. I mean, we could get them back or we can credit them to other events. The one that Debbie's referring to is a $1,000 deposit, 60 days out, but it is an entertainer that we use regularly, so that money could be applied to anything else that we do.
But we could also get a refund from that and do that at a future date, correct?
Correct.
Okay.
Well, we can't, wait, just to make sure, we can't get a refund to it. We can just apply it to something else, correct?
It says
we can,
60 days out.
60 days out, it is refundable. But like I said, okay. This is someone that we use that we could apply it elsewhere if need be.
Got it. Okay.
We can always hire them again, but I think a refund would be great in this financial climate.
Agreed.
Okay. The motion right now is with regards to canceling our 4th of July parade and our fireworks in the evening, or excuse me, not our fireworks, but our event in the evening. So I have a motion in a second. Do I have, I'm going to go ahead and just call the vote unless there's anybody else that wants to. We good? Okay. So Brian, yes or no?
I vote yes to the cancellation of both 4th events.
Okay. Debbie?
I vote yes, and I'm hoping that includes the refund on the deposit.
Well, I'm going to stick with just the motion right now, and we can that's something we can discuss in a minute. I just want to stick with the motion right now. Kevin?
Made the motion, yes.
David?
I support the motion, yes.
Diana?
Yes.
And Marianne?
Yes, in favor.
Thank you. And I think I'm the last one. Did I miss any board member? I don't think so. And I'm in favor. The motion passes. Okay. That's our quick win on that one. Go ahead.
Yep. The other event, I mean, I don't know if you guys want to wrap up today and regroup on Monday, but the other event that's closest to us is the Memorial Day flag ceremony. And JR has reached out to the veterans. They're willing. They have 25 veterans, I believe, that are committed, and they're willing to do it. Plenty of room on that lawn to spread chairs apart for social distancing. So if you guys want to address that today, or do you want to wait until Monday for that?
I'll open it up to the board to make a motion or to leave it be.
I make a motion that we proceed with the Memorial Day flag ceremony. That's my motion.
Okay. Thank you. Do I have a second? Debbie, you're a second? Thank you.
Yes.
Discussion?
I would encourage doing a Zoom call or some kind of a video as you always do for the community.
Yeah, I think we're going to do something on Monday.
But we got the motion right now on Memorial Day flag ceremony.
Yes, Memorial Day, yes.
Yep. Any further discussion? Okay, I'm going to go do roll call again. Brian, I'm assuming since you made the motion, it's a yes?
Yes.
David?
I'm still cautious, so I'm going to be a no.
Okay. Debbie?
Yes.
Kevin?
I'll be a yes. I'll be a yes.
Okay. Marianne?
No.
Just to clarify, Marianne is a no. It kind of cut out on that one. And then Diana?
I think I'm going to be a yes.
And I'm a yes. So I guess we got Diana, or excuse me, Marianne and David are no's for the record. Further conversations that we need to vote on for?
Yep. Vanessa, one
Yep.
more then. I think we should just go ahead and close the May Food Truck Friday because that is a large gathering. So I think Food Truck Friday should be closed. And I think we need to look at the Aloha to Summer as being an event that we do possibly returning to school in August as opposed to an end of school in May.
Okay. Do I have a motion for food truck and for Aloha Summer?
I'll make the motion. What Steve said.
I'll second.
Cancel food trucks for May, move Aloha.
And
second.
Diana, you're a second? Okay. Discussion from the board? Okay. I'm going to do roll call again. Brian, I'm assuming you're a yes?
Yes.
Diana?
Yes.
David?
Yes.
Marianne?
Yes.
Kevin?
Yes.
And Debbie?
Yes.
Perfect. Okay. I think, and I'm a yes.
Are there
Okay.
any expenses that were tied to that are lost, or is everything reapplied?
Everything's reapplied, I believe, other than food truck is a negative loss because of the revenue that you missed, but you have the savings and the expenses. And I think that's about $500.
Okay.
Yeah, Vanessa, I'm just gonna make a suggestion since there are so many people that join the meeting, if we could, considering hearing briefly for just 1 minute or so, if we voted for everything that's important before next Friday.
Yeah, there's a lot of questions that I see popping up there. So I have a meeting after this meeting with my staff to talk about some communication, and we'll put out a general communication listing of what is open on Monday and what's still closed, if that's appropriate to the board.
I'm good with that based as a recap based upon what we've discussed today. Board, are you good with that?
We'll send it out through cell service. We'll do an email blast. We'll put it up on the website. And we can still have time to put it in the Friday Flash because we postponed Friday Flash today until after this meeting.
Vanessa, this is Brian.
Yes.
The one thing I think we need to do, and I don't think we're prepared to make the decision today, but I think we need, or at least I'd like the board to consider, I think we need to re-challenge Steve and all of them on the pools and what would it look like? Because people are going to want to know, what did we decide? And I think we talked about it a lot. It's clear we need better clarity on what it would look like so we as a group can have a conversation and say, all right, yes or no, but based upon a more defined set of rules. Is that fair, Steve? Not fair?
Well, I think it's fair if you guys appoint a board member that you think would be able to speak for the entire board. So that way we're not going back and forth. Again, I put together recommendations based off of guidelines that I have. I don't have any best practices in how to open a pool during a pandemic. So if you can give me some assistance with board members, I think we can work through that next week and we can present a plan back to the board that everyone can find acceptable.
I think, just to be clear, I think, Diana, you had actually right away, as soon as that conversation came out, Diana, you had said you would like to be part of that. Is that accurate?
Yes, I will volunteer to be part of those, help develop those guidelines.
Okay. Do I have any other board members?
I'm happy to.
Okay, Kevin, anybody else? 2 board members enough for you, Steve?
I think that's fine as long as the board's comfortable with it, because I want to be able to bring a plan back that, again, so it's not a perception of that we're not organized. I mean, I want to try and get the next plan together that everyone can be comfortable with.
If you'd like, as president, I can join in too.
Okay.
Okay.
And if that's the case, I don't know that we need to workshop it then on Monday. I think that that group can just work together offline, and then we can resume next Friday. I would recommend that next Friday's meeting, though, we post it for 2 hours instead of just 1 hour.
I'm good with that. Any other questions?
My comment would be, if we're gonna, I think if we're gonna talk about pool openings next Friday, it'll fill a good hour or so, and it would be good to have Steve post to the community, okay, this is what the 3 board members and Steve and whoever else he uses come up with as the recommendation for a discussion. So then people can sit here and say, here's what they're recommending, there can be a conversation, and then we can all vote yes or no, because it's not black and white to me that it'll be a yes or a no, but at least, okay, here's what people thought was an intelligent alternative for discussion. And then we share it with the community maybe 36 hours in advance or something, so people can read it Thursday. If
Yeah,
that's
Brian,
I had Vanessa, Diana, and who was the third board member?
Debbie.
Debbie, gotcha.
Kevin.
Oh, no, wait.
Kevin.
Okay, was it?
Vanessa had.
I don't think I sound that much like
Yeah,
Debbie.
it was Debbie, right? Yeah.
No, it was Kevin. It was Kevin.
If I
I
can
did
speak.
Kevin and Vanessa.
Well, it was Kevin?
Yes.
Okay, gotcha.
Oh, sorry about that. Okay.
If I can speak, and I think we're moving kind of fast on this, but Steve, you had originally requested a workshop, like a 3 or 4 hour workshop. And I know we have some volunteers for the board, but I think many of us, even if we can just join in for a while on that, whatever hours you're doing that, I would be interested as well. I think we do need the full board input.
Well, it's got to be, I think it's got to be one way or the other, though. If we do a 4th, then that's got to be a public board meeting.
Here, I'm going to backtrack. I'm going to backtrack for a second here and bring it back. So here's what we should. I think having an open session with regards to this is probably in our board best interest. We have lots of people out in the community, and Christy, I do see your hand raised. I'm not ignoring you. I'll get to you in a second. So I think it's important that we engage the entire community, much like today. With regards to pools, we can just have a conversation. I would encourage prior to the actual workshop that you get the group together from the board to kind of get some consensus with regards to what the board would support moving forward and kind of what we're thinking. I think that would be helpful. Is that
and Vanessa, I can do that. I can do that on Monday. At any time that your 3 board members are available, I can make myself available for Monday. Hopefully we can get it done by Tuesday or Wednesday. We can get it out to the rest of the board, and then you can have an open discussion with the community on Friday if that works.
Is that agreeable to the group?
Yeah.
Okay. So we will have just on our workshop on Friday, or our board update on Friday will be a morph of the board, all the board members and community involvement, just like today, as we discuss the pools specifically. Is that what you're reading then? Is that kind of the consensus I'm getting from the board?
Well, we're going to need pool direction, and we're going to need camp direction, and then we still have to figure out what we're going to do with those fireworks. And we only have until May 15th to figure out what we're going to do with those fireworks.
Oh, meaning to shift it or just cancel it? Is that what you mean?
Yeah.
Okay.
I'm in favor of just canceling, but that's me.
Do I have a consensus from the board that we want to do something on Monday or Tuesday?
Wait, can we back up to the fireworks? My understanding was we did cancel the fireworks, and that
no,
was
4th of July. Yeah, 4th of July is completely canceled. There's nothing taking place on 4th of July. But just so everybody's aware, that there is a contract that the CROA board signed in January for the fireworks for 4th of July. If we cancel them, I don't know that the deposit's returnable. So we have to look into that. But we do have a cost sharing agreement with Lexington. Lexington's paying for the fireworks. So they're saying, hey, we'll still pay for them if you want to do them at your November event as opposed to 4th of July, because 4th of July is off the table. And I misspoke. It's not a CROA 4th of July. It was a CCS 4th of July funding.
Okay, Steve, my understanding when we discussed this numerous times before was that we were able to cancel that. We could postpone it, but we were able to cancel that, and there was no monetary loss. So could someone correct me what happened there?
There's nothing that happened there. It's a contract. I mean, it just depends on what the vendor. It just, yeah, bro. I mean, it was presented to the entire board in January and it was signed. So we would have to work with the vendor.
Somebody? Can somebody that's
You,
on?
so you're
back,
requesting that I get
whoa,
it out to
just
you?
sec,
I can
wait,
do
wait,
that.
wait, wait. Wait, everybody, just wait 1 second. I'm going to back up for a minute. The contract was signed with the previous board. I think this is something we're getting into, and I'm not trying to push this off because I agree, Debbie. We just need to make sure that we're all on the same page. But we're going into an hour overhand, an hour overboard. We wanted to make sure that we got these things done. We can figure out how we want to proceed with whether we want to just say we're done with the fireworks, or if we want to postpone them and do it to into November. But I'm feeling like we still have a resident who has their hand up, and it's noon. So I feel like we're spinning our wheels on this.
Vanessa, if I can speak, hold on, if I can speak please on this.
Yep.
On the motion for the 4th of July, it was my understanding the fireworks would be canceled and not delayed because we have no idea, as Kevin spoke, what would happen 6 months from now, nor did we know 3 months ago what was going to happen. To simply postpone those is, I haven't seen the contract, I wasn't on the board of January, but I would like someone to take a look at it real quick, and I'm sure they have it on their computer, and answer this before we get off the call.
Let me go ahead and I hear you. Let me go ahead and answer, pull up the question from Christy. I'm unmuting you, Christy.
Hi.
Go ahead, you're on.
Hi. No, I didn't mean to I hope I'm not disrupting your conversation. So I'm Christy Flanagan-Fedden at 1106 Banks Rose Court, and it just was a minor point. I just wanted to thank the board for having this meeting, and I know you all have a really tough job to do. You know, the town is frustrated, and it's going to be really difficult to make these decisions. As you know, as Steve mentioned, there are no best practices for a pandemic. It's completely uncharted territory, and I just appreciate the careful questions that you're asking, and I would just urge the community just that we have to be as patient as possible. You know, we've made a lot of sacrifices up to this point. We're all frustrated. I have 2 little kids absolutely bursting at the seams to get outside and enjoy our amenities. But we're facing, you know, our choices are maybe a week or 2 of extra frustration versus doing things prematurely and facing, you know, additional outbreak and public health risks. And so I am all for caution. I'm all for asking questions. I'm all for taking the time, even if it's an abundance of time, to have proper guidelines to really ensure public safety. You know, we're in it. We're committed to this really frustrating process. And I say, let's just see it through. And I just want to thank you for your hard work.
Thank you, Christy. I appreciate it. I'm going to mute you again here. Okay. Now we'll resume. Steve, I think that maybe gave you some time, hopefully, with regards to fireworks.
Well, I believe that the contract states that I don't think there's a pandemic clause in the contract that we can get our money back. So I think the contractor could come back and say, I want to hold the CROA board accountable to the deposit that's due. Now,
CCS,
CCS, I'm sorry. CCS, yeah, sorry, I apologize for that. But Lexington we have a memo of understanding with Lexington that they'd pay for this. I don't know how that holds up if they dispute that, if it's canceled due to the coronavirus and the pandemic. So the question is that we have talked to the firework vendor, and they have said, look, we'll postpone it. We'll push it back. They have not told us that they would give back the deposit completely, though. We haven't pushed any further on it yet until the board had the time to talk about it, but they will push it because they buy all their merchandise in advance, anticipating who's going to sign their contracts with them. So that's the question. And we've asked Lexington, would you still pay for it if we move it to November?
On this one, let's cut to the chase. Steve, talk to the vendor, look at the contract. We know we've canceled the 4th of July, whether we postpone till November or postpone till next year. What are our options, or get our money back so that we have facts?
Yeah, I'll certainly tell them we canceled it. And what will you guys do about that now?
Steve, what is the deposit
Steve,
amount?
could you just comment about May 15th? What
that's the deadline for them
is?
to know. Yeah, that's the deadline for them to know what we wanted to do one way or the other. That's the deadline that they've asked us to meet. Again, legally, I don't know how much that holds up, but that's the deadline that they've given us. But
Steve, what was the
as Brian
deposit
stated,
amount?
I can. It was half, I believe, of what the fireworks show. So it was about
$15,000.
Correct. Yeah.
$15,000, and wait a minute. It was $15,000, and we signed a contract without any refund clause or exit clause.
There's a refund clause. It just doesn't address pandemic.
So
yeah, I was under the impression that May 15th, based on your reports, was the date your drop dead date as you described it to cancel the fireworks.
That is the drop dead date that they've asked for, yes.
I think, Steve, if you could just go ahead and send the CCS contract out to all members of the board. I know the previous members have the contract, but Diana and Debbie will not. And I'm going to say that because we do have until May 15th, Steve knows the direction. He'll get the feedback from the vendor with regards to this, and we can then make an educated decision as to how we want to handle the situation. Is that reasonable?
Yes, but there was the third party in there that required a 60-day refund. So we do not have time on that one. So that one needs to be contacted.
All of those vendors, yeah, all of the vendors for the entertainment will be canceled. And then they can rebook them if we're still doing a November. If we're all clear from the pandemic for a November Founders Day celebration.
Any further comment, questions from the board? Steve, did we handle everything you needed to handle it for us? So we can take our scheduling. Go ahead.
Yeah, just one more clarification because I see a lot of questions popping up in the comments. So we will put together a complete listing of what's open, when it'll be open, all the stuff that we discussed today. It'll be out by this afternoon to the residents, so they'll be able to see that and reference that. And then on Monday, I'll email Vanessa, Diana, Kevin, if you guys are available like 10 o'clock in the morning, or if you want to do it later, but I'll email and we can try and get that scheduled.
Okay. And then we'll have an open conversation next week, correct?
Correct.
Okay. Further conversations? I see some thumbs up going on from the board members. Any other board members?
And we'll go 10 to noon next Friday.
Perfect. Any other comments? I'll open it, and I hate to do this. Are all the residents out there, have they heard what they needed to hear or texted what they needed to hear prior to adjourning this? I want to make, and again, next week, you can feel free to send us emails. Everything is all on there. So please make sure that if you have anything to say that you haven't had an opportunity to say, or you don't have the ability to raise your hand to me, send it out to the board or to me, and I can forward it onto the board, and we'll make sure that everybody has the information they need. All good? Do I have a motion to adjourn?
So moved.
So moved.
A motion from, I think it was David and Kevin, is that correct?
That's all right.
I'll be one or the other, doesn't matter.
One or two.
Motion from David, second from Kevin. We're good, doesn't matter. Pick a person. All in favor?
Aye.
Thank you very much, and I'm so excited to see everybody engaged in this. I really am. So please share your thoughts and opinions and send emails and however you need to do that. Thank you all.
Thank you, Vanessa.
Thank you, everybody.
Thank you.
Be safe.